Professor David Forbes is the Director of Phoenix Australia, Australia's National Centre of Excellence in Post-Traumatic Mental Health in the Department of Psychiatry in the University of Melbourne. David is a clinical psychologist of extensive experience in the assessment and treatment of mental health problems following trauma, and has worked in both acute, crisis and continuing care settings across the community mental health system and in specialist traumatic stress services. David is a member of many advisory committees for governments and other organisations and consults regularly to both state and Commonwealth governments on post-traumatic mental health, and particularly in the context of disaster, veteran and military mental health. A clinical psychologist, Rob Gordon, has spent the past 30 years working with people affected by emergencies and disasters. Rob was there in the aftermath of the Bali bombings, Christchurch earthquake, Black Saturday and Canberra firestorms, and most recently the 220 bushfires, and probably some range of other sort of traumatic areas and events as well, and other types of large-scale disasters. He's advised the Red Cross and governments, both state and federal, on how to assist individuals and the whole communities as they rebuild and recover. Welcome, David and Rob.
Thank you.
Thanks, Franco.
Yeah. So, it's crazy times we're living in. Can you imagine a time like this? Like, could you sort of maybe try to picture or try to place where we're sitting at the moment in the context of what we're experiencing nationally and globally? Maybe David, do you want to have a go at that one?
Yeah, look, certainly they are very unusual times, very uncertain times, and it's kind of hard to think of a period whereby there's been this much uncertainty, really, and the uncertainty that affects so many areas of functioning, both in terms of people's concern about their physical health, their mental health, with the impact on the economy. How long is this thing going to last for? What are the restrictions going to be on work, on play? It's really hard to remember a kind of a time that's been as transformational as this, really, in terms of its impacts.
Rob, what are your thoughts?
Well, I think the only comparable experience would be war. I grew up with my parents always saying whether things were before or after the war. And that's a massive disruption across every aspect of life. And I think it's about the only thing we can compare this to. Hopefully it won't last long as a world war, but the impact on society, I'm sure, will be lasting. It'll probably take quite a few years to see what those changes actually are, and particularly maybe changes in our values and how we live our lives.
I think you're right, Rob. It has potential to be one of those anchoring events around which we start to kind of think about times before and times after.
Yes.
Yeah. Is that a usual outcome from a traumatic sort of event or a crisis point? I mean, how different is this to a bushfire or to an earthquake? Or
well, I think for the people involved in a bushfire event, even a large one like Black Saturday or these current ones, particularly for New South Wales, it's still only a portion of the state, and the rest can more or less live their lives unimpeded. But for those who go through it, I think it is, we say a watershed experience. Things don't flow the same way anymore. So, but I think it takes quite a few years to really understand the changes that have happened, because we make them by increments to just cope with things. And then as we look back, we can start to see what we've done. And maybe some of them are good and some of them were not so good.
David, what are your thoughts?
Look, I think that in large-scale natural disasters or other particular disasters, even man-made disasters, that they are seminal events for the community concerned, as kind of Rob's described. But I think what's different here is they don't impact on the national consciousness in the same kind of way. And I think the fact that this is a national event and it's an international event, I think it kind of pervades the consciousness and the way in thinking about how seminal this event is in a way that goes beyond even the severe event that is kind of restricted in its impact.
It seems like it sort of strikes at the core of a whole range of fundamental values that you talked about, Rob, there as well. Globalization, connectedness internationally, a sense of so things that we've held quite highly valued in our economy, or at least politically as well, and the way we engage. I guess in some respects it sort of strikes at at the bit of that value, not the value so much, but the the fact that a lot of people consider that to be a core of what they do. Like,
I think that's right, and we're not perhaps used to talking about our values because they remain fairly stable, and we work within them as our framework. But actually, I've just been talking today to in a number of meetings with health workers, and of course, many of them are working at home now, mental health workers, and so they now experience this overlap between personal and professional, and having to work things out in a way at home that they never have to deal with when they go away from home to work. So that's a question of how do you balance those values? But I think we're being asked to make some of our values more explicit, and they mean how do we translate important values into conscious relationships via electronic media that perhaps happen spontaneously in a tea room, for instance, or with our neighbours and so on. So we're going to need to be more aware and reflective, and I suspect we'll only realise we need to do that when we start to feel we're losing it. We're losing something important in our social interaction.
David, you talked a little bit about that earlier as well, like that aspect of the transformational aspect that is the core. We're a social being, that we evolved to be. That's what makes us quite unique in some ways. A capacity to adapt and a capacity to work within groups, and that's quite at the core of our consciousness, isn't it?
And when we think about, what's the most effective thing we know to do in the aftermath of a trauma or a disaster, it's to connect with each other. And we know that social support's one of the biggest predictors we have in terms of bolstering community resilience, bolstering individual resilience, and maintaining mental health and well-being. And here in this environment where we're physically distancing, how do we find new and innovative ways in which we can connect, and not connect superficially, but also connect at a fairly deep level? That's when we talk about using social media, that's great so long as we're connecting more broadly, but we really need to ensure that we find ways to be able to connect with each other at personal levels, where if people feel that they are not being lost in the isolation and in the morass of large-scale public communications. And I think that that's a kind of critical issue and it's forcing us to think about each other in different ways, where because it is a community event, and how we act, one is in terms of, where, as we were saying before, in disasters, other people are usually a source of safety and support. Here it's got an element of, well, other people, are they potentially a threat? Am I potentially a threat to others? And how do we engage and how do we interact with each other in a society where those factors change? So I think where the public messaging about all being in this together and really forcing us to think we can only get through this as effectively and as safely as possible if we act as a collective. And that's quite unique in this circumstance as well. And the hope is actually that in itself can be transformational in terms of where we land at the end of this, ironically and potentially, as a more integrated and cohesive society than the society that entered into this crisis.
You want to make a comment there, Rob? Or
Yeah, I think that what David's talking about here, we know in our clinical work as post-traumatic growth, that in fact the attack and damaging of fundamental values and so on stimulates us to have to go back and say what really is important. And as David mentioned, there's so much research to show that the best predictor of recovery is not the amount of money that's spent, the infrastructure, but the social networking, the social capital. And I think we're going to be challenged to really create forms of social capital there which really, I think, translates into effective modes of communication where we share our lives, we discover that my problems are shared by other people, therefore it's not me, it's the situation, where we can ask questions and get help, and a whole lot of different things that flow from that. we're seeing these innovations of people, having drinks together on Zoom. A lot of people bring along their glass of beer or wine and chat. So I suspect after a while the medium will disappear. And it makes me think of some of the adolescents I work with who initiate a relationship, go through a long and turbulent relationship with all sorts of problems, and then have a heartbreaking breakup, and they've never met the person. They've had a relationship over the internet with somebody in America or somewhere, but they go through all the same tragedies. And so it shows that if we actually put ourselves into these media, we can create these human relationships. So we will learn something out of it.
Yeah. If I can just pick up, Franco, on one of the points that Rob's making, which I think is a really important one, this notion about post-traumatic growth. And often, up until, a few years ago, we were thinking, when in trauma and disaster space, we would think about, well, if I'm being impacted by something, I've necessarily been impacted negatively, or I haven't been impacted at all, in what we've called resilience, which we kind of incorrectly thought kind of riding it out without being impacted. The reality is these events change us. These events change the way we think, the way we feel, the way we view the world, the way we interact with each other. And that change, that's a change. It's not necessarily being changed by it is to some degree a natural part of growth and development. It's not as though we have this dichotomy of what we'd now better call kind of resistance, which is I'm not changed by it or I'm damaged by it. And I think being able to better understand that as human beings, we will be influenced, we will be changed by these events in one way, shape or form or another, and not slipping into the assumption that those changes are negative necessarily.
Because I think I think the point there is in the sense that we are adaptive people, and so naturally rely on some our own coping mechanisms, which are naturally that we can actually apply. Is that the point you're trying to make there? Is it and that not everyone's going to be necessarily traumatized by that event, and that the fact that we can rely on our own resources. Is that the point you're trying to make there?
Well, I guess I'm trying to, I think that's the point, and one other. So one is that there's strategies that we can use and that we can talk about that help people kind of stay well at this time.
Yeah.
And, feel like and cope as best as they can. The reality is, across the whole of Australia, we'd expect some level of uncertainty, apprehensions and anxieties, and that's not pathological. It's expected under extremely uncertain times, but that doesn't mean a mental health concern or problem as such. So there's lots of things we can do to stay well and to cope. But the other is that, these events do challenge the way we view the world, and those changes, even if we're coping, that still could include the fact that we see things differently, that we interpret things differently, that we view ourselves and humanity differently in terms of how we interact and the way we view what's important, and the predictability of the world. That so many things that we took for granted as stable, many things are unstable. What was interesting for me, and I know it's a trivial anecdote, was watching an interview with a couple of AFL footballers, where they were in their discussions with the media. They were saying, the AFL has stood true through every or AFL or VFL and all the state-based representations. No matter what's happened, football has continued. And to living memory, this is the time that football stopped, except for, as Rob was saying, World War II. And that these kind of things change basic assumption for what goes on despite crises. And whilst it's a trivial example to some degree with the AFL, it is an example of things that we can often predicate our diaries around, our lives around, fundamentally can change. And that means a lot for the different variables that can change in our lives. We can't necessarily assume stability in the way we did before. Even once this event is over, how we go to view the world afterwards is likely to have shifted.
So Rob, what do you think people need now and in 3 months' time and in 6 months, 12 months' time? I mean, 'cause that's the way we need to think about this, don't we?
Yes. I think we can jump into that question from the point that David's taken us to about post-traumatic growth and assumptions. And it has to do with the idea of resilience. one day I spent a long time poring over dictionaries to try and find out what resilience comes from. And if you go back to the Latin and then follow the Latin word, which is already a metaphor to bounce back, you eventually come to the Latin word for reeds, you know, reeds growing in the riverbed. And it's as though the Romans, who were pretty resilient, sort of recognized that the reeds get swamped and flattened by the flood, and then afterwards they come back up again, whereas the oak trees get swept out to sea. And that the essence of resilience, I think, means that we have structures that can flex and deform, but not shatter. And then when the situation changes, can reassert themselves. Now, I reckon we can translate that into really fundamental values. What are the fundamental values that we really need to put a focus on and preserve, because they will be the anchors for our values of life and the quality of life and what's really important. And that has to do with relationships and meaning and sense of purpose and so on. And so one of the things I'd be saying to people is, after a bushfire, there's an immense priority to focus on material loss, find accommodation, argue with insurance companies, rebuild your house and so on. But you can't do that fast enough without jeopardizing the rest of your life if you put everything aside. And then you've got a new house, but your relationships break down, or your kids are in trouble, or your health's gone, or something. So that what we have to do in a natural disaster is try and help people to stop and make a plan for how they're going to get through this while they hold all the unreplaceable things together, like their health and their relationships. When you get to 2 or 3 months down the track, I think that's the time for people to actually be able to make decisions about their quality of life. And if you think about how do we embody our values in our life so that they actually do have an effect, it's by living them out in routine practices that we don't think about. We do them automatically, and that their routines are molded and shaped by our values. So values have to be done all the time. And so the problem is, in the longer term disaster, is all of these routines get hijacked by immediate concerns. In this COVID situation, do the routines get hijacked by the inconvenience and difficulty of being in isolation and arguing about toilet paper in the supermarket and so on and so forth? Or do we actually say, wait a second, I need to keep my relationships alive. I need to have someone I can talk to about my worries, and take those really core values and really do that regularly, even though it's more inconvenient. And then when you come down in the long term, I think that's when we need to look back and reflect and process and learn and understand. I don't think we can do that at the time because we're so busy trying to work things out as we go. So, and when we come to look back, then we can ask the question, have I learned something that makes me shift my values? We know that often after a disaster, people say, you know, what I've learned is that the things I thought were important aren't really that important. What's really important are people and so on. When you have something really grinding and protracted like a drought, it's I think a similar process, but it's in an excruciating slow motion. And therefore the need is even greater to be keeping on reaffirming what's important, what do we need to hang on to under all these circumstances.
Yeah. David, you any thoughts on
that? Look, I love what Rob's just said, and I kind of concur with all of that. Look, the thing that I'd kind of probably just add to it, I think, is in an environment like this where there's this much uncertainty and things are changing really from a day-to-day basis, the importance of focusing on the here and now and getting control in the here and now. Where as a society, we're used to planning 4 or 5 steps ahead. We're future focused. Often we're focused not on what we're actually doing, we're focused on what we're going to be doing, how we're going to meet the future demands of our lives, in family life, in work life, in other areas of life, in our financial lives. But in an uncertain environment like this, what it does is, and in fact, what's a really important shift is to be able to focus on the now, because the future is so uncertain in many respects that it's hard to pre-plan for those, what might be multiple different outcomes that can change on a daily basis, really. So a lot of what we might see out of this also is a shift to, and if we're able to do it, a shift to focusing more on the immediate present. And when we focus our shift to the immediate present, we find actually often we do have the coping resources to manage the now, to not worry too much about the step 6, 7, and 8, to be focusing on the now, what strategies and skills and what's important to me right now, and focusing on the now in terms of my engagement. And I think that that has the potential also to make, if that is something we start to use as coping strategies, which is to engage in this moment, what's important to me in this moment, what do I need to cope, and what do I value right now, and doing that, then I think it has a chance then to embed those value changes in an ongoing way, actually during the course of the crisis, so to speak, as things unfold. And people actually have the potential to then learn to embed themselves in what's important as this is actually occurring.
I think we can keep on talking about this, and I think we might have an ongoing dialogue going on this in any way. In any case, we're creating an online channel, which is for this as an opportunity for the state government to sort of connect to regional communities and broader community just in general, and create a space to us to talk about these issues. And I guess part of the issue here, in a way, is, do you think there's enough conversations about what we've been talking about the last 15, 20 minutes?
Well, I really think these are very important things, Franco, that because there's a few other things that I think, particularly in the light of the current uncertainties, the fact we know about disasters like bushfires and droughts and floods, because we've got a collective experience, but we don't know anything about this. Nobody knows anything about this. Maybe the people who went through Ebola know something, but I think there are several other themes which would be interesting to talk about. One is anxiety, the anxiety that flows from the uncertainty, which I think is being faced by people in quarantine and in isolation, and flowing out of that, the sense of insecurity that more vulnerable people feel. And then the second one that I think, amongst others, is worth focusing on is the grief that follows from the losses that occur here, the relationship losses, the losses of lifestyle, the loss of plans and hopes, that people have lost their jobs and their finances are changed. And I think grief is something that we can deal much better with when we can acknowledge and define it. So I think there's two subjects there would be really helpful to have a conversation about at some other time.
David?
Look, I definitely think there's kind of multiple issues for us to continue to talk about, but perhaps just one thing that I'd want to make sure that we got across in this forum today really is that there are some simple things that people can do to try and stay mentally well during these circumstances. And these things can be very simple. And sometimes the simplicity of them suggests that they can't possibly work because they're too simple and too basic. But what we know in the trauma and disaster space is sometimes the simple things can be the most effective things. And they are things like, when things are uncertain like this, trying to control what you can, getting good routine, just setting up simple daily routines for yourself, good hygiene, good healthy diet, sleep, exercise, staying close and connected with loved ones, getting a single or two source of good information so that you're acting on accurate information, using the self-isolation time if you're in self-isolation to make as productive as possible and to reframe it in your mind as an opportunity to do some of the things that you wanted to do. And just generally speaking, look after yourself and your loved ones in that time. And it does sound simple, kind of basic routines, simple hygiene, simple self-care, but focusing on the day-to-day and focusing on those kinds of strategies can make enormous difference to coping and redirect attention away from drifting into the unanticipated possibilities of the future that we can't solve, we don't know, and just lead to increased anxiety and uncertainty.
That's great. Thank you very much. I think we might leave it there to another time. But thank you for giving time today, David and Rob.
Well,
Thank you very much.
Thanks for the opportunity. Okay.
Thank you. That's good.